In this video, we'll be discussing about cytomegalovirus, also called CMV. It is human herpes virus 5, and as it is a member of herpes viridae family, it is enveloped, linear with double-stranded DNA, and this is the largest among this family, not among all the viruses, because the largest DNA virus is pox virus, and the CMV, it is the largest among its own family, among herpes viridae family. And it is transmitted through body secretions like milk, saliva, genital secretions, and also sexual transmission, transplacental, or can be via urine, blood, or transplanted organs. It plays in salivary gland, respiratory tract, and kidney, and latent in monocyte. Easy to remember because CMV has M for monocyte. Now about the infections. So it can cause congenital, perinatal, immunocompetent, or immunocompromised infections. Starting with congenital cytomegalovirus, it is the most common intrauterine infection associated with congenital defects. So the most common features will be hepatosplenomegaly, jaundice, petechiae, which are purpuric rashes, also known as blueberry muffin baby. And the less common ones are microcephaly, chorioretinitis, and deafness. Now about perinatal. They are generally asymptomatic, but with time, there are some symptoms. Now moving towards the immunocompetent. So there is a glandular fever-like syndrome. It is infectious mononucleosis-like syndrome. Infection mononucleosis was for Epstein-Barr virus. But for this, it's infectious mononucleosis-like syndrome. So it will have minor things out of infectious mononucleosis. It will have fever, sore throat, but no major things like hepatosplenomegaly. And also, no heterophile antibodies are seen. Therefore, Paul Benel test and monospot test will be negative. And in immunocompromised, all those who have low immunity, like patients who had transplants or HIV patients, will have CMV chorioretinitis. Cytomegalovirus is the most common opportunistic infection among viruses in HIV and transplants. Cytopathic means it will cause cell damage. As it replicates within the cell, it will break down the cytoskeleton structure. And we can notice intranuclear and intracellular inclusion bodies under the microscope called owl eye appearance. As you can see here, this is a cell and we can notice both cytoplasmic and intranuclear inclusion bodies. In lab diagnosis, we are done with inclusion bodies. Now we have virus isolation. It is done with human fibroblast cell line. And for specimen, we can use urine washing. For antibody detection, we have ELISA, and the antigen will be PP65. This is an important antigen. And lastly, PCR. Now for treatment, drug of choice will be ganciclovir. Easy to remember because it is cytomegalovirus. It is saying that I am having something like this. This is G. Or even you can do with CC, ganciclovir. So, yeah. And foscarnet if resistant. Thanks for watching. Don't forget to like and subscribe and share with your friends.